We're on an exciting journey in Greater Cincinnati. The Health Collaborative brings physicians, health systems, hospitals, health plans, employers, and patients together, creating an objective, evidence-based performance measurement and public reporting system that is helpful to both providers and patients. Your Health Matters supports quality improvement by promoting transparency in healthcare and a strong patient-physician partnership. For the first time, many physicians can see their own performance data and how they compare to their peers. Commitment to quality is shown by physicians' willingness to make their data available to the public in order to help patients make better informed decisions. Participating primary care physicians understand that better care comes from measuring how they and their patients are doing and sharing those results with both patients and physicians.
Our participation in Your Health Matters has helped us tremendously as a practice on a few levels. And it really starts with quality improvement. All quality improvement begins with humility.
This is something that demonstrates your commitment not only to the individual patient, but to the community. It's what the patient needs that's important. And I think Your Health Matters helps us engage a focus around that whole concept, hopefully to improve the patient care, not just for the individual, but for our entire community. I would encourage every primary care doctor in the community to participate.
When you first do public reporting on a clinical measure, your score's not that great. So if we weren't entering data in the proper way, we couldn't pull that in terms of a report about it. So I think there's a conversion process that goes on in public reporting, is that first there's shock of, wow, that's my score? And then there is the movement to say, how can I improve it? What does this say about the care I'm delivering?
The outcomes reflect more than physician and patient performance. They reflect the impact the entire practice has on the patient too.
One of the things that I just loved was one of the medical assistants was going through the list, and she said, you know, Dr. Coles, this patient has not had their eye exam. I'm going to actually print a report of all of the patients that have not had their eye exam, and then we'll bring them in so that all of these patients can be up to date for their eye exam. In our practice in particular, we have a sense of competition, which is healthy competition between the docs. I think it will improve outcomes.
Family doctors, primary care physicians, do not have a different standard of care. We have the same standard of care throughout the country, no matter what your specialty is. So when you compare, when you determine what your practice population is doing, how they're actually performing on these measures, it gives you an advantage. Generally speaking, the initiative that we've started here in Cincinnati has helped the primary care physicians, has reestablished this important role of managing populations and comparing how you do with the standards of care established in the community. This is the most exciting time in my career because we now have tools, especially in our robust information systems, to actually tell physicians how they are doing, how they compare to others. It really is exciting.
As we all know, patient engagement is key to good health management. A strengthened partnership between patient and doctor can be achieved through Your Health Matters.
A couple years ago, when I would start to talk about the D5 with my patients, they had no idea what I was talking about. And now when I walk into the room, it's sort of the exciting thing at the end of the visit. The patient, you know, when we say you're at 5 out of 5 of the D5, the patients are really excited about that.
She always strives for me to know what my numbers are. She talks about the D5. I exercise, I eat right, I do the things that I need to do, knowing these numbers, and always looking when they're taking my blood pressure. I'm looking to see what my numbers are, that I'm in that range. Knowing my number empowers me.
One of the things that I tell my patients, especially diabetics, is even though I'm seeing you every 3 or 4 months, sometimes that's just not enough. So I've created a Facebook page, and I try to post information there every week so that the patients sort of have a go-to in between visits to stay in touch, check the information that we've posted there, and create a link to Your Health Matters. They do enjoy the site. I think it helps just keep them on track so they know what the numbers are and what they're looking for as far as the benchmarks to meet. I just think patient engagement is key to improving the outcomes.
His job is to monitor what's going on in my body My job is to cooperate with him. Your doctor is your partner, and that he's going to do his part, but he needs you to do your part.
Practices are changing the way they interact with patients, becoming more proactive and responsive to patients' needs, communicating in a way that's relevant to them, and empowering patients to take charge of their own health.
What we really need to know is, does this effort improve the outcome? We really would like the patient to engage us. We want them to go to the website. We'd like them to begin to compare their own information with our information and ask the question, why am I not where I should be?
It's bringing the whole community along one practice at a time. And then you could also say that you're bringing the practice along one patient at a time. I think the awareness of the purpose, not that any one of them individually was not aware of diabetes treatment goals, but to have those articulated as a standard across the practice, a consistency of purpose, regardless of who was dealing with what patient, it helped align purposes.
As an FQHC, I think we owe more to the community itself. So although the parameters established for quality in Washington are one set, these are parameters which mean something to our own patients and our own community. And what is the Federal Qualified Health Center other than a community health program? YourHealthMatters.org has provided a framework for us. They've given expertise in marketing, in consumer needs, in statistics, in access to all kinds of quality measures and tools we can use to improve quality for our own organization. I think that's been vital to our growth in quality and transparency.
Your Health Matters is founded on the belief that a healthy partnership between patient and doctor can result in improved quality of health care in the Greater Cincinnati area. Physicians doing their part to ensure patients receive quality care, and patients doing their part in managing their health.
So what Your Health Matters gave us was a language that both patients and doctors and staff could access to understand that these are the measures that we are looking at. And so the D5, Your Health Matters score, is really a reflection of that working partnership between the doctor and the patient.
Your Health Matters has helped us develop a focus so that we can align all of our quality programs around one uniform chronic disease which affects so many of our patients.
It's fun to see improvement. That's very gratifying.
With the quality scores and helpful information available on YourHealthMatters.org, physicians and patients are better equipped to improve care. And by working together, we can all achieve a healthier Greater Cincinnati.
It's been a great partnership. He takes the time to answer my questions, and I know that what he's doing is best for me.